All right, so I don't need to say we are live, Dr. Irgau, because we are live. All right, so just wanted to double check. All right, well, as I promised, we were going to be back in the next 4 minutes, but that was slightly off, but it's 3:11 now. This is American Surgery Center and CHRIAS Bariatric program. And today we are going to discuss navigating the holidays as a bariatric patient. Now we are about 3 weeks away from Thanksgiving, but that there's also Christmas coming, and then these are the times that people are getting together. And earlier session I mentioned, Dr. Irgau, for our audience that you are actually you are in Canada.
That's right.
So we still wanted to do the events because every time we do these, we have our dialogue, and some people find these helpful, even if some of these are repeat topics. But our patient groups are different, so that is pretty much what we are trying to do here. So I just need to double check one thing on the yes, we are live without a problem.
Great.
All right, so Dr. Irgau, because we didn't know exactly whether or not we were going to do it, so we kind of went on and off what we should be doing. So the holidays, well, it's not just for bariatric patients, but for me personally, it's a problem. Well, it's challenging, not just a problem, it's challenging. So now, and I'm not going to this time introduce the actual groups because we do that every week. So just kind of like maybe focusing on what's happening from the bariatric patient's perspective. If this is challenging for me, if that's challenging for you, what they go through, either if they're in the program before the surgery or after the surgery, what they should be expecting.
Absolutely. I mean, this is a very important topic for us because clearly the amount of food that we eat and consume is related directly to the struggles that our patients have had and to morbid obesity. Therefore, it is important for us to talk about how to mitigate situations where there is going to be plenty of food around us all the time for a number of days. For our patients who've had bariatric surgery, it's important for them to understand, obviously, that they still have physically a very small stomach, right? So they have to be mindful of that because they can actually do some physical damage if they overeat, particularly if they are in situations where there is also a lot of alcohol consumption. And although we talk about importance of being very, very moderate with their alcohol consumption, if that goes overboard and they're not really focusing, they can cause some serious damage. The stomach is very small, and really, if you eat really too excessively, there could be problems that maybe they can lead to some medical problems as well. So our patients have to be very mindful, not necessarily just about how much they're eating, but also of the fact that alcohol consumption has to remain very, very limited for them for a number of reasons. This applies to even more, I think, to patients who've had surgery very recently, right, where the healing process hasn't been completed yet. But to some extent, it does apply to patients who've been out from surgery for a long period of time as well. In terms of patients who are preparing for surgery, essentially, one of the things we absolutely try to avoid is for them to gain weight as they are preparing for surgery. Now, there is a very practical reason for that, Kemal, that you and I know, and that is some insurance companies actually penalize patients who gain weight as they are enrolled in the bariatric program, right? So, and holidays could be something that really sabotages their process if they don't pay attention, if they are not mindful. They could gain even a few pounds of weight gain. Could be something that could hurt their chances of getting authorization for surgery. So our patients who are preparing for surgery have to be even more mindful to this. It is obviously a huge challenge for some of our patients who are going to have surgery right after the holidays, for instance, because some of them have to be on a very strict diet, right? The new direction diet, where they're not allowed to eat anything as well at all. So, the best thing they can do is to minimize their exposure at that time. So if they are invited to social events where they know they will be tempted, it's probably not a good idea this year for them to be in that situation, particularly if they are preparing for surgery. So being mindful of the situations where you are likely to fail, you are likely to struggle, is the first step. Now, when we talk...
just so that we kind of separate a couple of issues.
Mm-hmm.
Because, daily case conference, and I keep saying that every time, many people don't understand what daily means. Because when it's an hour minimum, like not minimum, but we are averaging 1 hour, being able to do something every day as a team with the discipline that we have from the clinical and business, it's so easy to just say, you know what, like this week, we don't have to do 5. Let's just do, a couple of them, because we know that many of the other programs don't even do once a month. Now, the reason I'm emphasizing that is because what I see doing something every day when we go through a certain time of the year, then we have issues with scheduling, right? So like there are issues with scheduling with insurance-related stuff. There are issues with scheduling with providers' times off. There are issues scheduling with people, their occupation. So they may be a teacher, student, and whatever the job that they have, they may be getting a new job. But this one between Christmas and between Thanksgiving and Christmas is the most difficult one for everyone, because all those things are maybe happening at the same time especially for these patients who are struggling with this. But if I were a bariatric patient, like I just want us to kind of put this perspective out there. Just can we actually relate to the problem? So now Thanksgiving is coming, so there's this big pressure of celebration, getting together, and part of the getting together, the celebration is focusing on the meal itself, not actually having a quality time, right? I feel like I need to kind of stay away from some of those if I was about to get a surgery. If my surgery is going to be scheduled at the end of or the first week of December, unless I do a really good management of my time and timing, I may jeopardize my surgery, right? So,
absolutely.
Now, how can they manage that the best?
So that's a great point, right? Because there are some really important reasons for patients to be on a specific diet before the surgery, right? It's not just some ritual that people have to go through. There is actually a very important reason, and the reason is that we want the visceral fat to decrease before surgery. And why visceral fat specifically, we talk about the fat within the liver, for instance. The liver is a very solid organ, and it tends to be large when we are overweight, and the liver tends to be physically over the stomach itself. And when we do the surgery, actually, we have to push away the liver so that we can expose the stomach where we do the surgery. But if the liver is full of fat and is very hard and unyielding, it could actually be even dangerous to try to push it away, right? So with this diet that is done for about 2 weeks, sometimes for 3 weeks, actually people end up losing some weight. But more importantly, it's not how much weight they lose, it's that the liver becomes much less of a preponderant organ. It becomes much softer, much more flexible, and we are able to push it away very, very safely and makes the surgery a lot less challenging. So there is a very important reason for why people have to be on this diet. When they are on this diet, they're not allowed to eat anything else. For that reason, Thanksgiving meal is out of the question. Christmas meal is out of the question from that point of view. Now, one would ask, why would patients have surgery during that time? Well, actually, Kemal, it may come to a surprise to many people, but patients sometimes request to have surgery during that time. And the reason is because very often that would be a time in which they may have time off from work or other things. For many reasons, people want to have their surgeries done before the end of the year because that combines with the fact that their insurance may run out at the end of the year, their deductibles may be completed and things like that, or simply because they will have more support at home during that time than any other time. So it's actually very popular for people to request the the surgery towards the end of the year. And that coincides with the holidays. So for that reason, you are absolutely right. One of the best ways for them to avoid this is to, for instance, kindly, nicely decline invitations where they will be tempted to have things like that. But sometimes those invitations could be part of a family tradition where they have happened all the time, and patients may have to go there. But very often, what they may need to do is take their special diet with them. If it is okay for them to share what they're going through, then sharing that with their family members and seeking the support is obviously a good thing. But sometimes they may not want to share this, in which case they have to really be very, very careful about the fact that they will be exposed to the food, and food will be around them all the time. So that mindfulness is important. Then at the end of the day, one has to really look at priorities as well. So if they really, really find it very difficult for them to stay away from food, if they are in that situation, then just avoiding that situation may be the best thing to do, because adhering to that diet, Kemal, as we know, is very, very important.
Dr. Irgau, on this one, I do like this one where it says, stick to people who will keep you on track. So we have this similar problem, or similar actually approach for our patients with diabetes when I do the Wednesday wellness webinars with our team. If family members or who you live with, if they don't understand what you are going through, then you're in trouble. So we have to educate them as well, right?
Absolutely, absolutely. Remember, Kemal, bariatric surgery is still something that hasn't received wide acceptance within our society, right? People do not think it is legitimate to seek bariatric surgery to treat morbid obesity, because in many people's view, morbid obesity is a self-inflicted condition that people should have enough willpower to overcome by themselves, right? So they see bariatric surgery from that viewpoint. So it's very difficult for many patients actually to find support. In fact, it is not uncommon to hear many patients really having delayed, right, their consultation for bariatric surgery because they have been discouraged time and time again by other people who look at bariatric surgery from that point of view.
That's the perception problem that we have.
Absolutely. It's the perception problem. It's our society's view about morbid obesity. It's our society's view of people who struggle with weight as assigning the blame purely to them and not understanding that this is an entrenched chronic disease that it is very, very hard to get out from, right? And that view doesn't endear much sympathy for our patients. So it's not very easy. Having said that, if patients are able to get their loved ones to actually come to seminars, to attend sessions like today, for instance, where people can hear experienced professionals like us talking about morbid obesity and explaining to them that this is a medical problem and that they should be supportive of their loved ones, maybe things can change, right? So whenever patients come to me and say, is it okay if my spouse, if my significant other comes to the nutritional counseling, I tell them not only it's okay, I would actually encourage you to do that, because the more they know, the more they understand, the better their support will be through the process. So seeking family members, friends, colleagues who understand your struggles is important. Sometimes people are very lucky because they will find family members who have gone through the process themselves, and they will be their best champions. Actually, they will be the ones that
surgery, and if I'm going to have the family around me, I would want my older sister with me. So, and avoid my brother, right?
Exactly.
So,
right. You want the one who
once he found out that I'm doing this, he would just eat even more than what he normally would eat. But my older sister would be the most supportive one. So absolutely. I think choosing the right people is important.
It is critical.
But let's actually, and I do want to come back to this a little bit later. But in the case of having some sensible options, and I'm going to actually share this with you. And if you disagree with this slide, I'll take this off. So can we actually give them some alternatives to make it somewhat enjoyable? So then they can still have some family time and then they can still enjoy. This is just one holiday season, by the way, right? So from that point, I actually borrowed this from, I believe, FASMBS, if I'm not mistaken, or actually maybe you gave it to me last year. That maybe
yes, probably. It's very common actually for our nutritionists even to really give suggestions like that. So these are all great points, right? As they are saying is that essentially, if you try to decrease the caloric load of whatever you're eating, actually that is a good step by itself, right? So using skim milk, for instance, instead of whole milk when you're for your mashed potatoes, use fat-free cream soups in your recipes rather than the full fat version. Consider substitutes for sugar, for instance. Add flavor and herbs rather than fat, for your spices. So use Greek yogurt to replace butter.
Turkish yogurt.
Sorry?
I need to fix that. You said Greek yogurt, but that's supposed to be Turkish yogurt.
Oh, okay, yeah, absolutely. And then, with all these attempts, what we're doing essentially is we're saying, okay, you can have, the enjoyment you do with the types of food that are traditionally associated with these festivities, but let's try to decrease the caloric load of it. Let's try to decrease the amount of fat that we have in those dishes. And you know what? That's not only going to be good for the patient who is the bariatric patient, but it's actually going to be good for everybody, right? Because these are things that are actually killing all of us, right? The more we eat this highly caloric dense foods, the more we will struggle, right? So the idea of looking at holidays in that viewpoint is healthier. It's good, right? And it takes away the damage that comes by eating and overeating during the holiday season.
Would you suggest any of the, like maybe a patient who, I'll ask the question in a couple of different ways, a couple of different parts. So one is if the patient already had bariatric surgery, let's say last year, and they lost a good amount of weight, for this type of an event before they go, would you suggest if they can have like a couple of egg whites before going in, like would that be okay to have?
Absolutely. So you're talking about really preemptively trying to minimize hunger when you go to the event, right? That makes a lot of sense, Kemal. It's the same, strategy that we talk about when we say, drink plentiful of water, so that you're not going to be as hungry, right? When you, for instance, do intermittent fasting. So those are actually good strategies. But the other thing that they could also do, Kemal, and I talk to my patients about this, is plan, right? So if you think you're going to go into these events and you think you're going to pick up, a couple of pounds extra or 4 pounds, whatever it is, then have a plan afterwards for you to work harder to shed them, right? So that it doesn't become an ongoing problem, so that instead of being unhappy because you gain those 4 pounds and be feeling guilty and then stressed and then have some guilt feeling that leads to more perhaps eating and entering into a vicious cycle where you continue to gain, is that say to yourself, okay, it is inevitable for me to gain those 3-4 pounds when I get together with my family and I have this holiday. What am I going to do right after that? What will I do? What will I do different so that I will be able to get rid of them? So that kind of preparation to me is also makes a lot of sense, right? So for instance, you do that and then maybe do a little bit of a stringent intermittent fasting rather than doing a 14-hour fasting, that 24 hours that you've been doing. You could do maybe 16 or you could do 18 for that following week, so that you would be able to get rid of those extra pounds, but also you could work out a little bit more as well, be more active. So have a plan essentially that would allow you to mitigate. The worst thing that can happen, Kemal, is to go blindly into that situation, right? To go blindly and then suffer the consequences afterwards, and then get you into a situation where you worsen what has just happened. So be mindful, right? Plan ahead. And then if the situation is inevitable, just have a way for you to work harder in the following weeks so that you can get out of it.
The other thing of that planning is every first Tuesday of the month, we have a support group. And this may be the time that the support group would be a lot more beneficial for those. That's first Tuesday of each month. And I need to update this one. This has the webinar, but that's the second and fourth Tuesday. But first Tuesday of every month, it would be on CHRIAS and Surgery Center, Facebook accounts and the YouTube. Well, support group actually is a private event, so you have to register and then you have to request that from Facebook. So I think that would be a way of preparing and planning for that. Now, when we are talking about the time of the holidays and patients with morbid obesity or patients who already had their surgery. So for patients who already had their surgery, they can have a plan and then they can actually go through this. And then let's say maybe next day or later on that day or maybe a couple weeks, they can do much better and then they can recover without any health, like major damage, right?
Absolutely.
What we are concerned about is those patients who are about to get their surgery or they just had their surgery. So those patients, they have to stay away from those places that they cannot control their feelings. And especially when you are doing your 2 weeks, 3 weeks new direction diet, many people don't understand. They think that we just want them to lose weight. Well, that's not the case, as you were explaining. So there is a clinical reason for that.
Absolutely. And I mean, clearly, look, holidays are times that we wait for during the year. They are special times. They are times in which we enjoy ourselves. They are times where we have fun. There are times where we gather with the people we love most. And it is an extremely important time. And obviously, there is nothing that should take that away. That is a very important period for them. What we are saying here is that there is also a struggle that comes, particularly for patients who struggle with morbid obesity. It's a time in which things can get worse. And what we're saying is be prepared, be mindful, and that goes a long way. Just that understanding, that knowledge beforehand, that if they mitigate a few things, things could be better. That would go a long way to really help. Right, Kemal, because there's no point in really having a fantastic time and then feel guilty for weeks and months after that because you are in a rut because you've gained so much weight and you feel lost. But if you prepare, that may not be the case. But specifically for the patients who just had surgery or who are preparing for surgery shortly after the holiday time, obviously, it is critically important for them to even be more mindful and either be in a setting where they will have so much support that they can do their own diet without being bothered, or just avoid it totally for that year might be the best strategy.
Absolutely. And the other thing that they can just watch our videos on the YouTube channel. So that's a good support, right? So
that's the whole point.
If you were going through the bariatric surgery, which siblings you would be with and which siblings you wouldn't be with?
You're asking me?
Yes, because I named mine. So
I actually any one of my siblings would actually be fine. Any one of them would be very.
That's not the answer I was looking for.
You know what I'm saying? That Kemal.
But I have two sisters and I picked one. So brother was an easy pick to dish on. But I'm close to both sisters, but one of them is safer. Which one?
I know you're a straight shooter, Kemal, and I am not. So,
all right. So, after Dr. Irgau doesn't answer this question openly, so we have to make our own guess, I guess. So, okay, Dr. Irgau, thank you. So, I do want to actually probably repeat not the same thing, but maybe open the discussion later on between the Thanksgiving and the Christmas. And then also bring up our intermittent diet discussion again, because again, with the New Year resolution, and that was the first time we discussed that in December last year. And then after that, we covered it once, but maybe putting something together between that and this topic and also intermittent diet would be beneficial for those who are watching us. The other thing I was thinking is if we can maybe, which we do discuss these in different sessions, but maybe some indoor activities that they can keep them. Right now, like it's raining really crazy out here. So what are options that someone has to keep them active while going through this? And I mean, you have to kind of really think about all the time, so that you cannot stop doing something. So you cannot just park it somewhere and then you'll pick it up later on. It has to become part of the day-to-day, every minute lifestyle, not just for this, but everything else that we are doing. So, hopefully this is going to be helpful for some of our patients. And Dr. Irgau, you are actually, so you are one step ahead of me, because I couldn't do the live session from Turkey. Not because they didn't have internet, but because I was being lazy, probably. But now this is our first international live bariatric live event. So thank you for joining us from Canada, and
thank you.
And we'll see you.